Hey everyone, I have a quick little video to support you all going through the measurement and data analysis process. I just want to show you a couple slides here. If we recap, and if you've watched some of the previous videos that I've offered, we talked about doing a program evaluation for a behavioral health clinic. And so we went through the needs assessment. We completed a logic model, and we were concerned with patient attrition, why patients were leaving and not returning for their appointments. So we operationalized the logic model in a way that we created a number of different programs that were intended to improve patient satisfaction. And we hypothesized that improvements in these relationships could stimulate reductions in patient attrition. So where we are now is that we want to evaluate our key measure, which we've decided is patient satisfaction, as we're hoping that that will instill improvements in their well-being and ultimately improvements and reductions in attrition. So that was a big step in choosing the measure, understanding what the outcome is that you want to assess. And in this case, patient satisfaction, there's a lot of different ways that you can actually look at patient satisfaction. And there's just a plethora of different measures that exist. There's a helpful systematic review that I looked at on just the gamut of patient satisfaction scales by Fernandez and colleagues. And they really alluded to keenly that there's just so many different domains that you can actually look at. So first, we want to be careful not to do too much or too little, right? So for example, we have a number of different aspects of satisfaction for patients. It could be an assessment of their therapy. It could be an assessment of their access to therapy and care. It could be the environment where they're receiving therapy, and among other factors that contribute to their overall satisfaction. And again, we have to be mindful of what things maybe aren't going to be measured with certain measurements. So for instance, if we focus on therapy alone, what will we miss that maybe would be helpful to know about from the patient's experience? Based upon this information, I chose an interpersonal trust scale. And this assesses the relationship between patients and providers. It's been around for a while, and it's been validated for reliability. So when we decide what the outcome measure we want to use, and we look through the literature to find the measure, we have to then decide what it is, the analysis we want to use to assess the outcome measure, whether there's been improvements or decreases in what we're looking to see. So in this case, we're looking to see if patient satisfaction has improved or decreased based upon some of the things that we're employing in the program. So we want to evaluate pre and post data assessments. So one way we can do this is you can say when the patient begins care, that's your pre-data. So that could be your first data point. And then you determine a second interval. It could be 1 month, or it could be a number of sessions into therapy. And you just want to be consistent with that. And then you can compare those two time points. And if you did more than two, say you do monthly assessments, you can continue to look and see how the progression has improved or decreased over time. One way to assess this would be to look at the means in these scales. The means of pre versus post data assessments. And one way you could do this would be using a t-test analysis. And if you have any more questions about any of this, developing an outcome measure, finding an outcome measure, talking about analysis and working through these aspects, I'd be happy to help. I think it's kind of fun to look at all the outcome measurements that exist and to find a scale that works for your population. But before we conclude here, I just want to go over just a few limitations and considerations of this perspective of finding a measure and using that to analyze the data and measure improvements. So there's a number of pitfalls with quantitative analysis and measurement, which is one of the measures we just used, was a quantitative scale. It's helpful when you find a measure to read up on the data to find out who the population is that these scales have been normed on. In other words, a lot of measures have been normed on white populations and may not be applicable to any other populations beyond white. So there's a number of different demographic factors that are all going to be very important to understand. Further, I think it's important to consider what the measure has not captured. So if, in this example, if we focus on a relationship measurement between the therapist and the patient, what are we missing from that data? And if we're only focusing on that, what are the problems that happen from that data? Someone could potentially say that the relationship is not helpful between the therapist and the patient, but it might have nothing to do with those two individuals. It could be an environment that exists in the organization that we've failed to capture because we've focused on one aspect. So one idea to add validity and support to your data is to always balance this with qualitative analysis, because you can ask questions in a way that you can get a meaningful response from an individual rather than a quantitative analysis that may not capture questions that you hadn't considered. And you could give someone all the scales in the world, but there still may be questions you hadn't thought of that are impacting and factoring into the equation. So it's really important to balance this with a human-centered approach that values individuals and values their perspective and questions that maybe you hadn't considered. And that's it for now. That's a little quick overview here. And if you have any other questions, feel free to drop me an email. Happy to chat further. Thanks.